Hi guys, welcome back. We're gonna talk about cough. Now, imagine you are having cough. I'm having cough. It's very common during more common in cold weather or anything. If you're eating something wrong, you can have cough. So we're gonna talk about what is cough, and see, cough is very common. So if I'm having cough, should I be worried? What are the things that I should look out at? I should be worried that I should go and get it checked by a doctor, right? So one of the very important cause of cough, sorry, not the cause. We are talking about the red flags there. Okay, so the red flags that we're gonna talk here is that if you are having cough, right, and you're having chest pain, you should go and get it checked, right? If you're having cough and you're having blood coming out in the cough, in the sputum, you should go and get it checked. Okay, if you're having cough and you're having shortness of breath, go and get it checked. If you're having fever, if you're having cough and you're having fever, go and get it checked. And if you're having cough, if you're having cough and you're having weight loss, right, go and get it checked. If you're having cough and you have a long history of smoking, get it checked. If you are having cough and then you are having history of working in the refineries, working in the chemical industries where there's a lot of fumes coming out, a lot of gases coming out, go and get it checked, right? If you are having sudden onset of coughing, like you just like instant one shot, right, in within 1 2 seconds you're coughing out very severely, right, and you are an young adult, thin body, and you're having history of smoking, go and get it checked. So all the red flags that I have told, it suggests that you might be having underlying condition. Like example, if you're having cough and you're having blood coming out in the sputum, it can be due to any kind of malignancy, that means any kind of cancer, or it can be you might be having tuberculosis, right, or you might be having bleeding disorders, that means your coagulation products in your body are not formed well. You can be having chronic liver disease, right? And if you're having fever, cough with fever, right, it means that you're having maybe some kind of infection. You might be having pneumonia, right? You might even have tuberculosis, right? Tuberculosis, if you're having fever, this fever will be like low grade fever. That means this fever will only come in the evening time, not in the morning time. That is low grade infection. All the low grade infection that you are having will be having fever in the evening time, not in the morning time. This low grade of infections, right? And then if you're having cough and you're having sudden pain in the chest, it can be pneumothorax, right? If you're smoking and all that, there can be a rupture inside your lungs, right? And if you're having cough and you're having weight loss, very typical symptom of having tuberculosis, right? So this is what I want to say, that okay, if you are, and also yes, if you're smoking, right, if you're smoking and you have a history of working in the refineries, working in the industries with lot of fumes and all this, right, and you are having history of working in the farms, in farmland, right, in say in the paddy field, this can cause you a lot of lung disease, like interstitial lung disease. Just simple way, understand all these fumes that you're taking in, you're having particular, you're having the grains, you're having the spores, you're having the fungus, you're having the carbon particles, all this was going into your lungs and will irritate the lungs and cause you some serious implication. It's not going to happen in one shot, but it's going to happen in around couple of years, right? 10 15 10 5 10 15 20 years, depending on the patient, depending on the how much amount of exposure, how long you are exposed, and what is the concentration of this, and are you what is your fitness level, right? How healthy are you? How is your defense mechanism working? How are you smoking or not? If you're smoking, the condition will be more bad, right? Are you having any chronic disease like diabetes, hypertension? It'll be more problematic, right? So these are the things that you should watch out, that if you're having cough, and go and get it checked. So just to give you a basic idea, if you're having cough for more than around 7 days, 7 8 days, go and get it checked, right? 7 8 days, if you're having cough, it should not be there for a very long time, right? 7 8 days, you should definitely, your cough should resolve by itself, right? And obviously, I one more thing, if you're having cough that is productive cough, right, if you're having productive cough, that is sputum is coming out, do not take any medication to stop the cough. That means you'll be doing more damage than good. Your body is actually trying to throw out the sputum, and you're trying to give medication to stop your cough, right? So all this sputum will be getting accumulated in your body, so you don't want this. You want to throw it out of your body. Obviously, now if you're having, your cough is so severe that you are not able to sleep, you're not able to do your daily activities, is it hampering your daily activities, you're having a hernia, you're having a chance of bleeding disorder, that time we will give you cough suppressant in order to avoid cough, because whenever you cough, right, you're increasing pressure increasing pressure. So what you can have if you're increasing pressure, females, extreme cases, you might be having prolapse, right? If there's a hernia, you can also develop a hernia in weak spots, right? If you see your eyes, can be having subconjunctival hemorrhage, right? You might rupture small blood vessels. So if you're having more tendency of that, so that is the reason we always judge. Okay, are you having a cough? Like, what is the severity? If it is very very severe, then and only you will be getting the cough suppression, right? Yes, but if you're having dry cough, that is no sputum coming out, then obviously you can take cough suppressants. But always, just to give an idea, I'm just making this video, right? But quick disclaimer and quick advice that I want to share with you guys, that any medication, no matter how simple medication it is, always go and get it checked by a professional doctor physically, because there's a lot of limitation doing something via online or via internet, because your body is different. All the drugs working in my body will not work in your body. What is working for you might not work for me. And also I have to see that what other medication I'm taking, there can be interaction. If I'm having some liver disease or kidney issues or liver issues, my body can be having problem in throwing out the drugs. So that is the reason it's very very important, and you should go and meet your doctor personally, because you might think you're fine, but you might not be fine, right? There's a lot of symptoms, there's a lot of clinical signs, lab investigation that will be done in order to know how is your actual condition, right? So that is the reason, do not self-medicate, do not take medicine by looking on the internet or looking into a video, including myself, right? You should always go and get it checked by a doctor and follow his advice personally, because I'm making this video for a general understanding, right? General education. Do not take this video to avoid going to healthcare professional or replace the advice they give you. Okay, so that was a short video about cough. And obviously if you're having cough, if it is around let's say you're having cough for less than 3 weeks, you will say it is acute cough, right? If it is around 7-8 weeks or more, you'll say it is chronic cough. In between, you'll say subacute cough, right? Chronic cough, very very important. You have to see, are you having any kind of history of smoking, interstitial lung disease, are you having GERD, that is gastroesophageal reflux disease, or you're having any certain cancer, right? Acute cough can be bacterial, can be viral, can be a foreign body, right? So these are acute and chronic. That's how you differentiate what is acute and chronic, right? Remember, all chronic cases were acute one time. That means if I'm having a chronic condition, once upon a time that condition was acute, so it became acute, then became subacute, and then became chronic, right? So all chronic cases were acute one time, but all acute cases are not chronic. Okay, so that was a short video about cough. Look out the red flags, and do not worry about cough so much, right? If it can come and go, right? So you can take warm water gargle, you can take some ginger, and bed rest, adequate nutrition. You should go out easily in a couple of days. If it doesn't go, please feel free and strong advice to go and get it checked by your doctor, because tuberculosis is very 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 common. Smoking is also very very common, and especially the smoke that we are having is very very common, right? So that's all for now. Thank you. I'll see you in the next video.